In the pre-formal group, the physio's been working alongside us really well, and he's actually things like putting the children into standing frames. We can capture that on film, on evidence for learning, we can show it parents, but it's also a training tool for staff as well, so they can watch that and they know how to put those children in a standing frame.
My name's Lee Evans, I'm a physio that is employed by Alder Hey Children's Hospital, and I'm based here at Palmerston School. As part of my role within the school, we use evidence for learning with the children that are under physiotherapy, just to show kind of best practice with the children that we work with. As part of this, any physiotherapy programs that we complete, any postural care programs, treatment-specific sessions such as hydrotherapy, treatment-specific sessions such as strengthening exercises, functional-based exercises or stretches are all recorded as part of this evidence for learning.
Straighten it up. Another wrist. Straight.
In terms of kind of working with the children that we do in school, evidence for learning has kind of really provided a link to work even closer with school staff, with families at home. Some of the work that we do is quite complex and involved around postural management. It's involved around day-to-day physical management of some of our children. So actually having something like evidence for learning with our staff, with our families, just means that we can kind of work really closely together. With someone like Steph, who we work with in physio, she has a complex management plan to support her postural care needs. So this is that she needs opportunities to have changes of position, to have stretches, to be able to kind of be in the best position and comfortable that she can to do her work. So by using evidence for learning, what we're able to do is share the training that we do with staff on a day-to-day basis. So whether that be how to change position, how to move her appropriately, how to put her into the best positions to do her work, evidence for learning kind of allows us to show this for staff that work with Steph on a day-to-day basis. So it just reinforces all of the things that we need as a physio team, staff and those working with Steph to be doing. Steffi's hoisted into the achiever bed. When she is, just ensure that the backrest is up so that Steffi isn't hoisted on in a flat position. Hey Steffi, hey. There we go, lovely. We're going to pop this underneath.
So in this one we've seen Lee having some of the stretches. So obviously that's a really good example to almost try some of these different moves and stretches at home as well.
Exactly right. That's exactly what we do. Well, because she's got a good relationship with Lee as well, with all boys actually. But, so when we see these, we do them as well at home to stretch a little arm.
So the evidence for learning actually helps you stimulate what's at home and
exactly
in school
right.
as well.
Yeah, exactly.
Fantastic.
Right.
So if somebody like Mackenzie, who we work with in physio, he's had quite major surgery, and this has involved quite a few months of working really closely with school and with family. One way we've been able to do this is using evidence for learning, and that allows us to work through treatment programs with our children. It allows us to share this with families, as well as doing the work that we do in school and at home. It allows the parents to be able to kind of see what is going on in the school environment, for them to be able to replicate some of these things at home as well. So it's been incredibly useful for us to make sure that we're all working really closely together to get the best out of the children, their medical, their physical needs, and also kind of supplement their school needs as well. When using the Evidence for Learning app, what we know is that if there are things that we do that are filmed as part of kind of the kids' physio management plan, what we can do is we can tag physio within the children's information, and this then does allow others around the school and parents to be able to kind of access the work that we've done. As part of our physiotherapy management of some of our children, as part of our work with the NHS and alongside school, we as a physio team contribute to education healthcare plans. We're able to kind of really contribute closely to the children's individual learning through the PLGs and that this again just makes sure that the children's needs are met consistently.
It just reinforces what you do at school, and we can see it happening at home, and we can see the benefits from it.